What's his blood pressure now?
This is what the COVID surge looks like up close.
Let me put it down. I'm going to put it down.
An 82-year-old man with a history of heart disease whose heart has stopped. Doctors and nurses struggling to save him. It's a drama that plays out daily now at the United Memorial Medical Center, a small hospital in a low-income North Houston neighborhood that primarily treats minority patients.
Let's walk back to front.
We first visited here last month. We returned this week at the invitation of Dr. Joseph Verone. He wanted us to document the steady rise in cases he fears could overwhelm his hospital and others in coming weeks.
People are being very cavalier about corona. People are forgetting what corona is all about.
As Texas sets new records for COVID infection daily, Texans continue to congregate at the beach, in bars, or in demonstrations, as if the danger of infection has passed. It hasn't.
The next 2 weeks, we're going to see the spike of the protests that we had in the last few weeks, and then we're going to have a spike of 4th of July weekend. I am not predicting it. I'm telling you it's going to happen. This is not a prediction anymore. Right. I am 100% sure it's going to happen.
The increased caseload at this hospital shows it's already begun. The hospital is at 65% capacity, and more cases keep coming in daily.
Now just about all of the hospital's 46 beds are full, and the patients who are filling them are much sicker.
We're going to shoot the oxygen levels on this side.
Yet even as the case count climbs, Texas' rush to reopen has not slowed. Dr. Verone says there needs to be a balance.
Opening up the economy makes sense, but you should do that in a way that people understand that opening the economy doesn't mean coronavirus is gone. And ideas such as the requirement of using face masks should be mandatory.
Just by following these safe practices of wearing a mask.
Wednesday, Governor Abbott softened his stance on face masks, allowing businesses to require customers and employees to wear them. The governor insists even with the surge, Texas has enough hospital beds and ventilators to accommodate the increase of new cases. But Dr. Verone says that's only part of the story.
I can have all the beds in the world that you want. If I don't have personnel, it's completely worthless. And I am having problems finding nurses, and I hear from my friends in the medical center that they're having problems also getting nurses. This same class.
So this small hospital is struggling to recruit more staff and add beds to prepare for what could be a very grim summer.
What we're trying to do is not to overwhelm the system, which is what's going to happen in the next few weeks. It's going to happen.
Today, Texas reported 3,516 new cases of COVID-19. That's a new record. And so far, more than 2,100 Texans have died from the virus. Stay tuned. Phil Archer, KPRC Channel 2 News.